So I'm here today to tell you why we're here and who we're talking about and what's happening and why this is so important. So I'm going to give you an example from my own family. This is my mother-in-law, Fervid Trimble. Very unusual name, Fervid. Never heard it before or since. She was raised in a literally dirt-poor farm outside of Chinook, Alberta. But she was a remarkable woman, greatly respected by our family. She managed to put herself through university and get a Master of Education and become a teacher in the early 40s. It's a pretty remarkable thing. Here she is at the age of 86. She chose a senior's residence herself. She was very proud of being in control of her own life and also of not being a problem to others. And here's Fervid's family care team. That's me when I had different color hair. This is the real color, by the way. My husband, Fervid, and my sister-in-law, Kathie, who is sometimes known as the Rock, because she was the rock that the family could always depend on. So what happened with Fervid is that she was living in an independent apartment, senior's residence. She got the flu, she got dehydrated. She went to the hospital for one night, she got rehydrated, she got sent home, and she was still feeling pretty punky in the morning. So they decided that they would transfer her to the care facility that was attached to the senior's residence. And what happened there is that instead of getting better in a few days, which is what was expected, that she would recover, she started having some really serious cognitive problems. And eventually, this didn't happen quickly, but eventually we found out that she had been given new medications. And this is one thing that I sort of keep at the forefront of my mind, that if you have a frail elder who's having new symptoms and they've just been prescribed new medications, you should suspect the drugs. So what was happening with Fervid, and I didn't even know this term at the time, she was delirious. She was hallucinating. Sometimes she didn't recognize us. Sometimes we couldn't wake her. She was making strange arm movements, repetitive movements that we didn't understand. I know now that it was delirium and a drug reaction that she was having. But at one point, the psychiatrist who went to a number of the residential care homes in that area actually diagnosed Fervid with vascular dementia. Now, one of the problems is that sometimes these psychiatrists, they don't know the patient at all. They just arrive, see them on that day, see what condition they're in, and decide on a diagnosis. Family didn't believe it. We'd never seen any signs of dementia. So because I have a library background, I guess you could say I'm kind of an out-of-control compulsive researcher. I have no control whatsoever. I must research. So I started looking at the new drugs she'd been put on, looking at the side effects she was showing, looking at the side effects of the drugs, comparing them to the symptoms, and it seemed pretty clear to us that she had something called Seratonin Syndrome. Two of those, I might like to point out, two of those symptoms, confusion and a rise in temperature, which are indications of Seratonin Syndrome, are also indications of urinary tract infections. And she got a lot of antibiotics for that diagnosis. I'm not really sure she had them. She did eventually get C. difficile too. I think that's important to know. So after we asked the staff to do a medication review, I brought my faultless research with me that was from sites you could not argue with. And by the end of the meeting, the medical staff had decided to give her what they were calling a drug holiday. So what happened is that I think this is a very telling picture. Is Fervid over-medicated? This is her a few weeks later, after the drugs had been deprescribed. She came back entirely, completely, cognitively. She did not come back physically. By this time, she'd been in the care facility for 2 or 3 months. She'd lost a lot of function. She'd lost a lot of confidence. And also, I believe that particular care facility had the right to decide whether you could live independently or not, and they decided that she couldn't. So we learned a lot from Fervid. She, after this incident, which I think would probably have led to more drugs and possibly antipsychotics and probably a much earlier death, she actually lived for another 4 years. We had some remarkable times with her. The family received the most amazing conversations from her before she died. They were the kind of conversations that are not ordinary. They were basically passing to us all of her wisdom and love for us. So I still can't read this paragraph aloud, so you're going to have to read this paragraph. This is one of the things that Fervid said to us before she died. All of these conversations we had with her, we would never have had if she had died earlier, basically delirious, hallucinating, not recognizing us. I think as a society, we're losing a lot by not having our frail elders in a state that they can speak to us, the things they need to say before they leave this world and the things that we need to hear. So I'm actually got a quote here from Dr. Ralph Jones, who's sitting right there. I didn't realize he'd be here, which I like a lot. It's not just a quality of care issue, it's a quality of life issue. And Ralph says, I've seen dramatic differences in the quality of their life when the burden of their medication is reduced. Yay, Ralph. I'm just mentioning some books for the sake of lay people. A Bitter Pill by Dr. John Sloan, who works for Home Vive at Vancouver Coastal Health. My Mother, Your Mother. If you have an elderly relative in care, you should read this. And Are Your Prescriptions Killing You? A rather blunt title by a clinical consulting pharmacist. So I'm dedicating this, as I always do, to Fervid. Here's Fervid enjoying some quality of life, an Alaska amber beer, some Mexican takeout, and her family in the garden. And there's my contact information if you need to reach me. Thank you very much.